All right, good morning, everybody. We'll go ahead and get started. Welcome to our June PO monthly call. So for today, we're going to run through a lot of reminders and just FYIs. So we'll start with a quick status update on the print shop orders. We'll talk about all of our upcoming committee meetings that we have. We have a number of them. We'll run through the VBR deadlines that are fastly approaching here on July 1st, and talking about the remaining ways that physicians and practices can meet their physician and practice level learning community requirement. We'll talk about the performance measure timelines and just as a reminder to everybody when those run through and how the data lag is associated with that and when you'll get final performance numbers. Quick reminder on some of the things that we're troubleshooting with our data right now and working with the data vendors to resolve, and then we'll talk about the upcoming learning community events for the next couple of months. So for the print shop, we know that we've gotten a lot of orders in, which we are really excited about. So just last week on Thursday, we sent our first order in to Colossus. That is the first step in the process. Colossus is now going to go through and print all of the resources that were ordered, put them together, box them up, and get them shipped out to the individual practices or POs that had placed those orders. So that first order is in. So if your order was placed on or before Wednesday last week, yours was included in this first round. As a reminder, we are going to be batching these just because of the vendor that we're working with. That's just the easiest solution. We're going to be batching them on about a monthly basis. And so from now until about the end of June, early July, we'll be collecting the next round of orders, and then we'll be sending that over to Colossus as well. So just as a reminder, every practice has a 200-page budget. We're planning on monitoring usage throughout the year, sending out status updates to practices that have not utilized any or all of their budget to remind them that that's an option. And then when we get closer to the end of the year, we may end up redistributing resources from practices that have not utilized the service to practices that have exhausted all of their budget, just so that there isn't anything that goes to waste. So yeah, that's the print shop update. For the steering committee, so we have our next steering committee meeting this Thursday, the 11th at 4 o'clock. It's going to be a jam-packed agenda, so we're going to be talking largely about the upcoming statin measure decisions that we need to make, and talking about more broadly the measurement timelines for performance measures as a whole. So talking about whether or not it makes sense to shift from a currently our 14-month performance measure timeframe that we've allowed for that extra 2-month buffer period to a 12-month period and aligning with the calendar year. So there's trade-offs for both, pros and cons for both, and wanting to talk to the PO representatives that serve on the steering committee about those options and determining what will be best for the collaborative as a whole. And then talking about and reviewing some of the current challenges, the performance measure updates, and then thinking about what we're going to be doing for this first year of the statin measure. As a reminder, there won't be a true target associated with statin prescribing for this first year, but there will be a survey that'll be being launched to try to better understand barriers and limitations and patient attitudes towards CG or towards statin utilization. So talking with the steering committee about that. For our research committee meeting that'll be taking place the following Thursday, the 18th, we have finalized currently our intake procedure for this, for being able to ingest new partnership ideas. We're going to be launching a triage survey that's going to live on the MCTTD website. When that's up and ready, we'll share that out with you on one of these calls, on a future one of these calls. It's going to live under the Contact Us page, but we get contacted all the time by folks wanting to partner with us. Oftentimes there's really well-aligned objectives, sometimes there's not. And that triage form is going to help us determine whether or not that's that idea for partnership is something that we can entertain. And if it is, whether or not that's something that we can just talk to the program directors with, or if we need it to go to the full research committee to determine if that's something that the collaborative finds as a priority or something that aligns with our objectives. All right. For the advocacy work group, that'll be taking place on July 17th. We're going to plan to follow up on the individual advocacy projects that the groups have been working on and do a brief report out. When we met in January, there were 11 members that participated, and there were a broad array of different voices. And so that meeting has slowly grown over time and become a very productive opportunity to discuss all of the different ways that we can work together to try to advance a number of different areas of focus throughout the collaborative. And so if you have folks that are interested in that, let us know. But that'll be the meeting for the 17th. All right, so for the EMR work group that takes place on August 4th, we'll be talking to each of the different groups. And so as a reminder, this group is broken down by EMR vendor, and each group has their own specific task or project that they have themselves selected. And these meetings are really just meant to be a time for those individual work groups to come together, debrief, have some time to work together in small breakouts, and then report back to the group as a whole to be able to take inspiration and lessons learned from other groups into their own groups. And then if there are any other members of the collaborative, specifically those that have Athena, Allscripts, Veradigm, and other EMRs that you're very familiar with and are more or less like a super user for, and you would like to participate in this group, we would love to have you. We do need a little bit more representation specifically from Athena and Allscripts and Practice Fusion. So if you happen to be one of those and feel the call to participate, we'd love to hear from you. All right. Shifting gears a little bit to VBR. As a reminder, the VBR year does end on July 1st, and so all tasks need to be completed by end of the day on July 1st. That includes both PO, practice, and physician level requirements. So just a couple of quick reminders here. The practice performance on the A1C Year 2 performance measure is on this year's scorecard. And so that I have a slide in just a minute here that talks about when final performance for that performance measure is going to be released and shared out with you. So that one will be on this 2025-2026 scorecard. However, as a reminder, the performance on the UACR and CGM measures are accounted for on the next year's scorecard, the 2026-2027 performance scorecard. And that's because those performance periods have not yet ended. And so we'll look at those timelines together as well. But as a reminder, those run through the end of August, which is obviously a couple of months after the end of the VBR year. And then just as a final call out, as we kind of are approaching the 11th hour on getting in all the learning community requirements, only MCTTD sponsored activities can count for learning community credit. So we get asked a good chunk of the time, which is a totally reasonable question to have. Hey, I did this activity through this other organization, can this count for my learning community credit? Unfortunately, no. It has to be something that is sponsored by and created by MCTTD. All right, so with that, let's talk a little bit about the remaining learning community credit options, and then we'll go into the performance measure timelines as a refresher. So I'm going to go through these a little quickly just because there's a lot of them here, but first option here is to do a brief survey on the implementation of an MCTTD tool. So if your practice has or is planning to implement a MCTTD tool as a standard operating procedure or as a standard workflow within your practice, we would love to hear about how that went. And lessons learned, barriers encountered, anything that we can share out more broadly with the collaborative to help inspire folks to be able to utilize these types of resources more broadly in their practices. That's the first option. The slides, like usual, will be shared out, and the link to the form is linked at the bottom there. The next option here is to review the newly launched MCTTD prediabetes website. So as a reminder, in April, we launched that new website. It's prevent.mcttd.org. If you've not yet taken a look at that, please make sure to do so. It's something that our content experts and designers have worked quite hard on, and we want to make sure that it's useful for you. So if you get in there, take a look at it, poke around, check it out, and have some feedback for us, we would love to hear from you. Again, that form is linked on the bottom here. We want to make sure that it's addressing the actual practical areas of need. All right, next one here, motivational interviewing one-on-one coaching. And so MCTTD has partnered with Amy Schneider to offer self-scheduled online coaching sessions for patient motivational interviewing. There's a number of time slots available for the patient engagement coaching sessions still. So you can see those available dates here down below on the 16th, 18th, and 30th in the available times. These are 30-minute sessions, so it's not like that whole time that I have listed there, but those are the blocks that are available. So any 30-minute periods in that is currently available. You can see that patient engagement coaching session in blue there. That's the link to the sign up. So you'll be able to click that and sign up for a session if that's something that's of interest to you. Participation in that does meet your physician level or your practice level credit, and if the person that's completing the session is a physician, it will also meet their physician level requirement. So it's kind of a twofer if it's a physician completing it and the practice hasn't already met their practice level learning community requirement. All right, so another physician learning community option here is to review one of our relatively newly launched insulin utilization tools. And so you can see here are 4 new insulin tools for type 2 diabetes. So we have the managing low blood sugar with glucagon, getting started with long acting, getting started with fast acting, and then just generally getting started with insulin as a little bit more broadly here. And so if you have used one of these resources or are planning to use one of these resources with patients and have feedback to share, positive, negative, somewhere in between, both, we would love to hear from you. We're constantly iterating our resources and tools. So after we publish something, it doesn't mean that it's locked in stone. We are constantly making updates, especially based off of user feedback. So that's another great opportunity to have your feedback turn into something that's tangible. All right, next option here is Satisfy. And so as a reminder, we recently launched our Satisfy low carb recipe generator. This is a resource that's available to anybody in the collaborative, free and open source. This is an AI-based recipe generator where a person can go in and either create a low carb recipe from scratch or tell it that it would like to low carbify an existing recipe and provide it with some of the information about an existing recipe and ask for suggestions and ways to make it a lower carb option. So if you haven't had a chance to check it out, I highly encourage you to do so. And if you would like to use this as your way to get your physician level learning community credit, you can submit a survey about it, letting us know what went well, what didn't work quite so well, and any other feedback that you may have. All right, and then we also have the the performance measure progress survey. And so as we've been putting out the performance measure status update reports, the PDFs that are available through the administrative portal, those are available to provide feedback on as we kind of start thinking about how we're going to present the data for the future next year performance measures. This is a great opportunity to let us know what you liked about those performance reports, what you want to make sure stays, and then anything that didn't really kind of click for you, that wasn't clear, or anything that may have been missing. If there are other ways to visualize this information or things that we may not have thought of, this is a great way to have that feedback get incorporated as we start to foray into the 2026-2027 performance measure. All right, and then the CGM user experience program, with which hopefully most of you are aware of, is the only one that has a little bit of a time limitation to it. So for folks that are interested in participating in the CGM user experience program for credit in the for their physician level learning community credit, we do need to receive your attestation form by June 10th, so Wednesday. That just enables us to have enough time to get the CGM shipped to you, and then for you to wear it for 2 weeks, and then for you to complete the testimonial form after the end of the wear period, which the completion of that testimonial is what actually marks your physician level learning community credit as complete. And like I say, that is what enables us to have all of those steps complete by that July 1st deadline. All right, and then you always have the option to complete a recorded learning community event quiz. And so on the admin portal, you can access it through the mcttt.org website and click on Learning Community. You'll be brought to a page that looks just like this, and you'll see all of these different, when you click on Learning Community events, you'll get taken over to this Learning Community Quizzes page where you can select one of these historical or pre-recorded learning community events. You can watch that event and then take a brief quiz on that event, which will then mark your credit as completed. All right, so shifting gears now to the performance measure timelines. So as a reminder, like I said, the performance for the A1C measure is on this year's scorecard, so the 2025-2026 scorecard. The performance measure period ended for that measure on April 30th. We are set to receive our next data refresh at the end of this month. That refresh is what will bring our data through the end of April and enable us to start putting out those final performance numbers. And so if you're waiting on that and you're wondering, did we meet the measure? Is the performance on the last progress report that we received a couple of months ago our final performance report? No, you're getting one more that we'll be putting out in the very early part of July with your final performance and whether or not you met that measure for the purposes of the scorecard. All right, so for the other performance measures, the PCP UACR, the nephrology UACR, and the endocrinology CGM interpretation measure, these measures are, while the performance measure period is ongoing currently, the actual score for whether or not your practice met the measure is encompassed in the 2026-2027 scorecard, and that's because the performance measure period runs through that end of August timeframe for the actual performance period. You'll note there the differences in the rewards periods, but that's just based off of how specialists' VBR compensation periods differ from the primary care. Final performance reports for these will be made available on the admin portal in mid-February. And again, even though that data, that performance measure period runs through the end of August, that mid-February timeframe is when we'll be able to put out those performance reports based off of when we'll get our data refresh that brings our data not only through the end of August, but with an extra month or two so that we can allow for run out. Sometimes data backfills, and since we have time with the distance between February and when the final performance would be or needing to be reported for next year's performance scorecards, we have time to allow for that run out period. So final performance reports for those three measures will be put out in February. All right, and so speaking of data, I know that this was also included in last month's slides, but just as a reminder, we're currently aware of and working on an operands issue. So the operator, the greater than or equal to sign that goes in front of certain numbers such as A1C is something that we had built in logic for to account for in claims data because there's ranges associated with A1Cs. For example, you have less than 7, 7 to 8, 8 to 9, and greater than 9. This was not something that had previously ever been used in the clinical data. It was always equal to signs, so it was discrete values, 6.8, 7.2, etc. We have since started receiving non-equal sign operators in the clinical data as well, specifically for POs that participate in Health Focus. And so we are duplicating that logic that we had built into the claims data to also function in the clinical data. So if you notice a number of patients that have since started slipping into the denominator that may not truly have type 2 diabetes because they are being identified based off of a less than 7, which we can't say is above 6.5 or below. This is something that we're aware of and working on fixing. And we're not totally, let me revise that. So that is going to be implemented as a part of the June 30th data enhancement. And so this issue will be fixed prior to the end of the UACR and CGM measures. And obviously the performance measure for the A1C is already ended. I will say this issue actually behooves you from the A1C measure because all of those patients that could have inadvertently been included would have been patients with a very well-controlled A1C. So nothing that we need to necessarily go back and fix. It's just actually benefited practices from the A1C measure standpoint. All right. So shifting gears here now, finally, for the learning community events. Our next one is going to be on June 19th in just a couple of weeks on team-based care with Alicia Major. So we strongly encourage PO leads to attend this meeting or this learning community event. We think that it would be especially beneficial for you folks. Alicia has led practice and care transformation, infrastructure development, and performance measure initiative networks for years, specifically from an independent primary care practices all the way up to large multi-specialty physician networks. So the event will focus specifically on the implementation of QI programs and care management programs. And then if you do have questions that you want to make sure are addressed, please shoot those over to us in advance, and we'll make sure that those are discussed on that learning community event. And then looking forward just a little bit further, is in July on the 17th, we have insulin and type 2 diabetes with Dr. Mizukami Stout, our endocrinology program lead. And then just as a quick aside, attendance at this specific one, as you noted, it's after that July 1st deadline, will count for the following year's physician level learning community requirement. So if you are planning on getting a requirement from a learning community event, make sure to attend the one in June. All right, with that, looking forward to next month, our PO calls will be on Wednesday, July 8th and Monday, July 13th.